My name is Linda Monterroso. I was born and raised in New York in the Bronx. I started with genetic medicine, working in the lab, did that for a few years and then transitioned into clinical research for traumatic brain injury patients, and then just started going up the ladder in terms of management. After being in New York for 30 plus years, I relocated to Memphis, Tennessee to take a job with St. Jude Children's Research Hospital. And I managed the leukemia and lymphoma department there for clinical research. And now I work for a biopharmaceutical company. I've done a lot of supervisory work and management. I love development of my team members, and so that's why the Doctorate of Health Sciences and the clinical practice leadership track seemed to align with my goals. The goal has always been to lead the clinical research department as a whole within a nonprofit or an academic setting. But I have so many other passions and drives, and the Doctorate of Health Sciences really helped me reach that. I wanted to explore the sibling well-being, caregiver burden aspects of individuals with intellectual developmental disability. I am a sibling of someone with IDD, and siblings are often ignored even from a very early age. But there's a lot of responsibility put upon us, and I never saw research really that explored what that looked like across socioeconomic groups, what was out there in terms of support for siblings, what was lacking in terms of support for siblings, and whether or not being from a low-income household plays a role in really well-being. I would love my research to be further explored by other researchers. I really hope that it just starts the conversation, a broader conversation that gets people thinking a little bit more about how to incorporate sibling support. The faculty at GW has just been incredibly supportive. I love the accessibility to them. My advisor, Dr. Maring, is just amazing, and I love meeting with her. We meet frequently to talk about things, and she understands my research because she works in that space, but she also understands the passion and why it's so important to me. The Doctorate of Health Sciences married all different aspects of my career and my personal life, especially with my brother.